My name is Jody Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I am delighted to have with me Jody Frei. Jody is the Director of Quality and Process Improvement at Northwestern Medical Center. So Jody, thank you for being with me today.
Oh, it is my pleasure. I'm happy to be here.
And today we're going to talk about the patient experience.
Yes.
And how we can gather feedback so we know how well we're doing and how we can improve.
Yes.
So that's going to be fun to talk about. So before we do that, though, Jody, you've been with the organization a while. So maybe you could tell our viewers a little bit about who you are and then how you got your role as Director of Quality.
Sure. It's been a very exciting path for me. I am a physical therapist, and I've been with Northwestern Medical Center for a little bit over 15 years now. I started out in the role of rehab manager, managing our therapy department, and transitioned to the manager of organizational informatics, implementing our electronic medical records and thinking about how can we build an electronic medical record that would work for our patients, that would work for our providers and our physicians and our nurses. So that was very exciting and drew me into this concept of quality.
Yes.
And how can we assure organizationally that we're providing the best services to our patients.
And you also, on your educational journey,
Yes.
have followed that path as well.
I have my bachelor's in physical therapy, Bachelor's of Science in Physical Therapy, and I went back to get my master's in managing innovation and information technology.
Yeah, so it's beautiful. It's been so fun to watch you grow and really to find yourself. And I remember early on talking with you about quality.
Yes.
So it's really kind of fun how this has all come together in the path that you've taken.
Together.
So fantastic. So why is it important to get information from our patients on their experience, and how do we do that?
Sure. Well, first and foremost, our mission is to provide exceptional health care to our community. And the patient satisfaction survey, the results that we receive, the feedback that we receive from our patients, from our community, is so important for us to gauge how are we doing in achieving that mission? How are we doing caring for our patients? What opportunities do we have? What are we doing well that we want to continue to foster? So the survey itself is mailed to patients who are discharged from our hospital services. We also mail surveys to patients who have received outpatient services, such as laboratory services, diagnostic imaging. Patients who receive services within our physician clinics also receive a survey in mail, also through email and soon to be text.
Oh, wow. That's a good addition.
We're trying to make this survey as easy and convenient for patients as possible because the feedback we receive is so incredibly valuable. We study the feedback that we receive, and we initiate change based on the feedback that we receive from our patients. And we realize that it takes some time. It takes a little bit of time to sit down and complete the survey, especially in a thoughtful way. So we're trying to make it as easy and convenient for patients as possible, so that we get as many returns as we can, because the more information we get from our community, the better we can respond to that feedback and really continue to grow and evolve.
Exactly. It's so important to get that feedback.
Yeah, exactly.
So what type of questions will folks find on a survey like this?
Sure. The survey asks questions that really run the gamut of the visit or inpatient stay. The survey starts out with some questions around communication. First and foremost, did your nurses, did your therapists, did your physicians treat you with courtesy and respect? Did you feel listened to within the organization? The survey also asks questions about communication about medications. Much of what we do really revolves around the medications that we're ordering and administering to our patients here in the hospital. And it's important that the patients always understand What is the name of the medication that I'm taking? Why am I taking this medication? How long will I be taking this medication for? And what are some possible side effects that I might experience? So the survey asks questions about that. The survey also asks questions about how well patients understood how to care for themselves when they left the hospital. It's really important to us that we not only provide good quality care while patients are within our walls, but once we kind of set them back into the community, they go back home, that they're able to care for themselves in a way that they don't necessarily need to come back to the hospital, that they're self-sufficient in managing their health. And continuing to strive towards wellness. So the question does the survey does ask questions about your understanding of how to care for yourself after you left the hospital. And the other vein within the survey is the environment. While you were here at NMC, was the environment clean? Was it quiet? Were you able to sleep well during your stay? Because we understand that really is critical in recovery.
Absolutely. And hopefully with our new private rooms,
yes,
things are more quiet.
Oh my goodness, it's wonderful. Our new progressive care unit with our single rooms has just created such a change in the environment and really allowed us to, especially during those nighttime hours and even during the daytime hours, create some separation so that the patients can rest and recover and have time with their family members.
Excellent. That's been such a great change.
Oh my goodness.
And it's so beautiful.
It is gorgeous. If
so
people
beautiful.
haven't been here, they should come.
Exactly.
To visit.
So what do we do with the information? So those are the questions,
yes.
and so now it's the value. Why do we want folks to fill this out? What are we going to do with it? Do we ever do anything with it?
We absolutely do. It allows us to target initiatives. It allows us to focus in on both what are we doing well and we need to continue to do well, and also what are those areas for opportunity. So we listen to the voice of the patient and we hear people. The question asks how well we do in certain areas that we talked about earlier, and they ask patients to rate us from 0 to 5 or 0 to 4 in some questions. And we want patients, our goal is that patients will feel that we were able to serve them in a way that they would answer always to the survey. So did we explain the side effects of your medication? Yes, the nurses and the physicians explained to me the side effects of the medications with every medication that I received, every new medication. That always happened. So if we're seeing anything other than that, which is truly our goal, to exceed patient expectations, then we want to respond and be thoughtful about strategies that we can take to achieve that goal. We are right now working with our medical directors, our physicians throughout the organization, our nurse managers and our nurses in our inpatient setting and within our physician clinics and our outpatient settings on continuity and consistency with communication about medications. So it really allows us to target in and focus in on those areas of greatest opportunity. Our nurse managers are doing a wonderful thing now. Our ED nurse manager, our emergency department nurse manager, and our progressive care nurse manager are visiting with patients while they're here in the hospital.
Very cool.
To ask them when they're feeling well enough to have a conversation with the nurse managers. We're asking them, how was your stay? How was your night last night? Were you able to sleep? How was the transition from the emergency department, if the patient came from the emergency department, to our progressive care unit? Was it smooth? Did you have to wait very long? How did we do in serving you in that capacity? So we're not really waiting necessarily in all cases for the survey results to come in. We want to get feedback while patients are here and understand how can we make any adaptations if somebody is not feeling in the moment that perhaps they were listened to. The nurse managers can bring the physician in or bring whoever it is in that may be that person and assure that the patient is listened to. So really making those changes in the moment, as opposed to waiting for those survey results to come in. So we're doing some pretty great things, and we wouldn't know to target in on these areas if it weren't for the feedback that the community is providing us.
That's a beautiful why right there.
Exactly.
And the fact that the managers are coming in and rounding and seeing if everything's going okay, so we can prevent something or we can correct it on the spot, because we want that exceptional experience. And we want folks to be comfortable checking that top score.
Right.
That we always do it.
Every patient, every time is our goal.
Yes, and if we're not, please tell us, because we want that for every single patient.
Exactly.
So when you get these survey results, do you actually contact the patients, or how does this work?
Yeah, not unless the patient asks us to contact him or her. So the survey itself is confidential. And we look for trends, we look for responses, we look for opportunities, and again, we look for those glowing moments that we can continue to foster. If a patient checks a box that's on the survey saying, please contact me, if a patient has a concern or a story that he or she wants to tell, there's a selection within the survey that says, please contact me, and we will contact the patient in those situations to have a conversation with the patient. But otherwise, the survey is confidential, and we're paying attention, we're studying the data, the information, but we're not necessarily honing in on the patient name themselves.
Okay.
Unless they ask us to.
Sure, that makes a lot of sense. Now, you've talked a little bit about the emergency department and the progressive care unit. And I know we have other services in the outpatient.
Yes.
So how are we gathering feedback on the outpatient side?
Very similar survey is sent out after patients receive services within our outpatient arena, including our primary care providers, our orthopedics, urology, pediatrics, and lab diagnostic imaging. They receive a survey that is not the same as the inpatient survey, patient satisfaction survey. The questions are geared towards the services that the patient actually receives. So the questions are a little different, but along the same lines. How did we do while you were here? How did we do communicating with you? How clear were you in regard to the follow-up instructions that were provided to you? And we studied those survey results in the same way that we studied the results of the inpatient surveys. The one piece I'd like to add is that we do work through a third-party vendor, a company called Preskany, which is why much of this information is kind of blinded to us, like the anonymity, the confidentiality. So we receive the results, but we are not actually the organization that sends out the survey or that actually receives the survey. We get the results from our vendor, who is Preskany, and they are a vendor for many hospitals throughout the nation. So we're actually able to identify how we are performing in regard to patient satisfaction compared to our peers throughout the hospital. Many of the questions on the survey are actually federally required.
Okay.
We call these questions our HCAHPS questions, and this is a subset of questions within the survey. And the reason that CMS, the reason the federal government requires these specific questions be asked is so that patients can, these results are publicly reported, and patients can go to a site called Hospital Compare when they're selecting which organization they want to receive services from, and look at what the patients have said about particular hospitals. So they can look at the results of patient satisfaction scores and compare hospitals. So another purpose of the survey.
That's great, and thank you for giving that extra information about the website as well, that people can go on and compare and get that feedback. It was really exciting. I know you and I were recently at a meeting together for our Quality Improvement Committee that has leadership and medical staff, and I was really struck by the fact, because we always think, are the medical staff, are the physicians really engaged in this? And I can say yes, and they are. And I thought it was really exciting about how physicians are using the feedback and doing teachable moments with the providers, bringing them together for meetings and trying different things, simple things, to make a difference in patient care and the experience. That to me, a total engagement. I really felt that.
I felt that too, and I was listening to the physicians talk, in the Quality Improvement Committee last night, and they're really talking about partnering with the patients. So it's no longer this model where the physician, has a treatment plan, and it is something that the patient, just accepts. This is a partnership with the patient, and they want to engage with the patients, and assure that the patients understand why they're making the recommendations that they're making, and really have a part in that decision making about care. So I'm so pleased to see that, and we know, as a quality department, that we rely on our physicians within this organization to lead our quality initiatives. So it's really exciting that we have a medical staff that's really stepping up and doing that.
Exactly. Well, thank you so much for being a guest today.
Oh,
I really
my pleasure.
appreciate it. Our time has come to a close, but it's great to hear the importance of getting patient feedback, and so to encourage everyone, if you do get a survey, it is important. And we hope that we've already rounded on you while you've been at the hospital or in the practice setting. But when you get a chance to give us feedback, it is really meaningful, because we want to make sure that your experience is exceptional. So when you get the survey, you feel confident that we've always delivered that exceptional care to you. And if we haven't, let us know, because we want to make it so. So thank you for choosing Northwestern Medical Center as your local healthcare option. And thank you for entrusting your care to us, because the experience matters to us. Thank you for joining us today.